Welcome back. Well, Pfizer just announced a deal that will significantly grow access to COVID treatment. It says it will allow its COVID pill to be manufactured and distributed in 95 less wealthy nations. Here to discuss the move is Dr. Stephen Corwin from NewYork-Presbyterian Hospital, the CEO there. Sir, thank you so much for your time. So this pill comes on the back of another one from Merck. So two very simple antiviral drugs, relatively cheap to manufacture and to distribute. How much of a game changer are they?
Well, I think the Pfizer pill is quite effective in trials, and I think that's a big positive for us, and it even looks more effective than the Merck pill. So when you start thinking about how we're building up our armamentarium, we have effective vaccines. We know that giving the booster helps to prolong immunity. And now you have pills that can treat disease when it comes on. I think that we are continuing to elevate our way out of this crisis. I would say, however, that vaccination is the most important thing, and then these medications on top of it will make a big difference. So vaccinating our children is going to be really important, and continuing to make sure that unvaccinated people really understand the risks of COVID and getting vaccinated. So I think that that's the key thing. But the Pfizer product looks quite good.
Speaking of vaccinations, Dr. Corwin, good to see you again. Since the last time we spoke, the FDA has given emergency use authorization to those 5 to 11 to get the vaccine. And I'm wondering what you're seeing within your hospital group. Are parents eager to get their children vaccinated?
Alexis, for the most part, the answer is yes. But I think this will follow a curve similar to what we saw with the initial rollout of the EUA for adults. That is, there's a lot of pent-up demand, and we're seeing a lot of children get vaccinated. But then there are the individual conversations you need to have. Going to church groups, going to community-based organizations, dispelling some of the issues, including the issue around the prevalence of myocarditis in this age group, which it wasn't seen in the study in 5 to 11-year-olds. So I think there's going to be a big upsurge, then it's going to fall off, and then we're going to have to do the slow, hard work of making sure that people have individual conversations. I really thought that Senator Cruz's comments about Big Bird getting vaccinated on Sesame Street were unfortunate at best, because we don't want children to be dissuaded from getting vaccinations. We want them in our schools. We want them unmasked. We want our kids to be able to learn. And I think in-person learning is certainly a lot better than remote learning. We know that.
And Doctor, I want to stay on the vaccination question. What do you make of the New York directive that now everyone over the age of 18 is eligible and can get the booster shot? New Jersey seems likely that they will follow suit. The FDA and CDC could issue the same directive as soon as next week. Are you in favor of that move? And then do you think it detracts from sending out the message that people should first and foremost get inoculated?
I think both are true. I think it's true, and unrelated. And what I mean by that is it's still very important to get everybody vaccinated to get close to herd immunity. So I continue to think that we've got to push that. Boosters for everybody, I think, is going to be the norm. We know that the vaccine efficacy wanes. It's more important, obviously, in older people and people that are over the age of 65, infirm people. But my children are in their young 30s and they're all going to get boosted. I think that that's the prudent thing to do. So I do think that getting boosters is going to be important for people over the age of 18. I also think that continuing to educate people to get vaccinated the first go around is critically important as well. We'd like to see both, to be honest with you. I am concerned about the uptick in infections that you see in Europe. So it's unclear to me at this point whether we're in the beginning of a fourth wave as we get into the cold. And you've seen the increase in some states over the past number of weeks. So that is of concern as to whether we get into a fourth wave. We've also seen a little less uptake this year in the New York region on flu vaccination. That would complicate things. So we're certainly not out of the woods yet, but we're getting there.
Doctor, I'm curious if you've had to lay off any workers within your hospital group because they've refused to get vaccinated and they're not complying with hospital protocols.
We did. We have 37,000 employees and 11,000 affiliated doctors. And out of the 48,000, we laid off under 170. So about 150 were laid off. I think that when everyone saw that the mandate was there and the mandate was real, I think everyone decided that it was the better part of valor to get the vaccination. So we saw very little resistance ultimately to getting the vaccination. But yes, we laid off 150. I was sad to see those people go, but we felt that we needed to do it to protect our patients.
All right, Dr. Corwin, thank you so much for your time. We've seen a 45% increase in infections in New York just since Halloween. So we still are not on top of this. Thank you, Stephen Corwin, for your time today.